Well, good morning, everyone, and welcome to another Learning Lunch hosted by FormatApproved.com. My name is Wendy Whitmore, and I am the CIO for the Format Corporation and your moderator for today's Learning Lunch session, which is on the topic of utilizing electronic health record templates for improved practice workflow. Oops. Sounds like Joy's got a little noisy microphone there. All right. Our presenter today is Joy Rios. She is one of our premier Format Pro Network members who's a certified EMR professional and subject matter expert on the topics of meaningful use attestation and electronic health record customization. She has worked directly with multiple EHRs to develop training programs for them for the past several years and has successfully attested for meaningful use on behalf of numerous ambulatory practices. She's also currently writing our Certified Professional Meaningful Use Champion curriculum for the Format training program. Joy holds an MBA with a focus in sustainability in HIPAA and health, and she is also HIPAA and Health IT certified with a specialty in workflow redesign. So she's the perfect person to help us out with this topic today. Before we begin, a few quick notes for the attendees. If you have questions during the session, please enter them into the chat area during the presentation. In the second half of the presentation, we will address as many of those questions as time allows. If we do run out of time, we will submit all of the questions to Joy. She will answer them. We will post them to our website and send them to you via email link later in the week. Also note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of the event. It's one of the most common questions we get during the session. So know that we will send that out to you. No need to worry that you'll miss it. And so with all of that aside, let's get started on our topic. And thank you, Joy, for joining us today.
Yes, thank you very much for having me.
So one of the important questions that we have come through at Format Approved is, whoops, hold on again. Looks like we're having a little technical issue here. There we go. One of the questions that we get frequently at Format Approved connected to some of the consultant channel in our network is why should a practice evaluate the practice workflow? Why should they do that?
Well, the workflow essentially is determining how things get done in a practice. So it's really important to know who is doing what in every single clinic. So especially when it comes to patient flow, you want to know, who has what responsibilities, what exactly do they have to do, how often do they do them, how do they do them, when do they do them, and just, making sure that you are tracking, whose responsibilities and tasks, what they are and how they get done. So before anybody, everyone here is probably at some stage or transition of an EHR. Either they are about to do it or they've recently done it, or maybe they've done it in the last year or two. But, being able to track what was done beforehand, typically in a paper environment, you have paper triggers. People have an inbox, and that piece of paper tells them how to get something done. It's like an action piece. And when you transition over to an EHR, those paper triggers kind of go away. So it's important to study your workflow so that you have an idea of looking at your practice from an electronic point of view. And oftentimes EHRs offer a lot of solutions and they design their EHRs to mirror your workflow. But to be honest, those are really just a starting point, and it's really important to be tracking your specialty's point of care documentation, how you guys communicate, how you manage your documents, and essentially what gets measured is what gets managed. And so you want to, measure where you are so that you can manage it through the transition. And, customizing your templates and, really customizing the EHR helps you get there. It helps you create those electronic triggers.
And so tell me, so when you first implement an electronic health record, it is kind of an out-of-the-box functionality for most practices without doing any customized templates. Is that sort of standard electronic workflow sufficient for most practices, or I mean, what's the difference between utilizing some customized templates and using that sort of out-of-the-box version?
Well, a lot of times, an out-of-the-box version will have more information or cover more topics than maybe your specialty needs. So, they may have hundreds of templates within their EHR, but it's possible that only 5 are relevant to you. And, even the customization of, I'll get into this a little bit more later, but about like questionnaires and, how you interact with a patient, it is different with, from practice to practice. So making sure that you capture that is really important, and there's no EHR that's going to know that out of the box how you do it.
Well, that makes sense. And when somebody implements a customized template, I assume from health record to health record, it's going to be a little bit different how they go about that. I mean, are there some that are pre-designed? Can you borrow them from other doctors, that kind of thing?
Yes, absolutely. So most actually come pre-designed, and we'll get into this a little bit more later too, but the way that you can design it is differently. So if you can, some EHRs will let you do it when you're actually with the patient, when you're live talking to them, and tweak a template little by little and gradually have it more detailed and relevant to what your practice is. And others, it's sort of an across the board, you have to do it in the system administration area. And it kind of requires an IT person. So it kind of depends a lot on the EHR vendor and how their software is designed. So it's important to get to know your EMR so that you can customize it, or at least know how it can be customized.
And is that generally training that's provided by the vendor directly?
Yeah, it's their job to make sure you know how to use their system. It's not necessarily their job to do it for you, but yeah, they do provide training. Typical training lasts about should at minimum last about a week, and then ideally they would be providing online training, or if you sign up for a support program with them, then you could continue going and getting training, but they're not going to be doing every single step for you. That's where folks really need to have to sign up to be really hands-on and get to know their EMR.
Right. Yes, and sort of ongoing training is one of those important topics that pops up over and over again, with some of the folks that come through our website with questions. In terms of going through the process of customization, what are the kinds of things that the clinicians should consider when they're thinking about customizing?
Well, if you've been studying your workflow, you want to pay attention to what works. Like, what are the things that you work really well in your practice? What are the things that don't work? Are those areas that you want to stop doing, or just by the nature of switching from paper to electronic, how is that going to be changing? And then what is just doing just great, you want to sustain and continue doing the way that you do. Areas to pay close attention to is, the patient flow. Making, some EHRs you can design your own, what do you say, how do you call it, like the exam rooms, where you can include, okay, the patient, you can assign a certain exam room for a patient. So when they check in, you not only know that they've checked in, but you know where they are located within your clinic. So that would be the equivalent of putting a paper record in the file on the outside of the door. So creating that trigger for people to know is also really helpful. So patient flow, the point of care documentation, so the template itself that the practitioner is using, and also consider internal and external communication. So there's a lot of EHR systems, in fact all I believe come with a messaging system, and how do you communicate with other users and folks in certain roles within your clinic, and are you going to be maximizing the use of that communication? And another one to consider is document management. Document management is huge. Like there's a lot of different areas that you can upload, scanned documents from, the patient record, but you need to make sure that people know where to look for those. Sometimes they can be put in, 10 different places, and if a user looks in 9 of those and they're in the 10th one, then, that's not going to help, provide the best care for that patient.
Mm-hmm.
I've noticed that some of the often underlooked customization is included in correspondence. So either welcome letters or birthday notes to patients, things that can help you build relationships with your patient population. That's a really good way to customize your EHR and use it. And also questionnaires for specific diseases or problems that you're tracking. If instead of actually including it as in part of the template, you can include certain questionnaires. And one of my favorite things that I've seen EMRs do is creating order sets. And that is where at the click of a button, some EHRs will allow you to write a prescription, order a lab, set up a screening or, put an immunization and actually do printing, routing a task to another user in that office, all at the click of a button.
So basically mapping.
Create that order set in order.
Sorry. So what I'm hearing is you're saying that in some cases you can map a whole series of tasks into a singular
Absolutely.
function. Okay. Well, that makes sense. I mean, I can see how that would improve the workflow process to kind of limit the number of clicks that you need to do, or the number of drop downs or steps you need to take to get to a commonly repeated task. Is that kind of?
Exactly.
Yeah.
The whole idea is that you want to, information that needs to be input or, over and over and over again, you want to reduce the work required to input that same amount of information. So, it's kind of giving you a head start so that you can move on to what's next instead of thinking, oh, I've got to type out this thing or, click all these buttons to make this stuff happen.
Right. I see you've got a bullet here for reporting capabilities. Is that, I know that's not a template necessarily, but that's a lot of the customization.
It is actually. So, with the reporting, you can be, each clinic should be setting up their preventive alerts and certain problem areas that they're, problems that patients have that they're tracking. So ad hoc reporting is certainly a way that you can customize the EHR, and that gives doctors an opportunity to sort of slice and dice data and be able to, if you want to track all the women in your, send out a message for all the women in your patient population, you can use your EHR to help you do that. And so, that may not help with day-to-day workflow, but it certainly can help with, just you getting a return on your information that's in there.
That makes sense. So in terms of, I know that it is a serious investment. One of the complaints I hear about from clinicians is about customization and template building and that sort of thing is that it's really time consuming. So, out of curiosity, since you've had a lot of first person experience in the practices, what do you think are the kind of the upside and downside decision making around doing a lot of that customization? And who should be doing it? I mean, is that the clinician that's doing that? Is that the, I'm sure it depends on the size of the practice, but what's been your experience around that?
Well, it certainly is a team effort. I recommend, first of all, you need to have, let's say you have a practice that has 1 to 7 providers. You would typically want at least one of your providers to be on that team and maybe 2 nurses to be helping you customize that EHR. It's really is a team effort. And so especially with things like, meaningful use, there are certain criteria that need to be met by every single role within the office, within the practice. So everyone does need to get involved, and it can't just be that one person has to take ownership of the entire thing. It's fine to have one person be somewhat of a team leader and, you know, a super user or whatnot, but, you know, this is something that everyone needs to get involved in. So the pros, one, you know, one of the biggest benefits that you get is getting, you know, the standardized data capture and being able to, you know, at any moment, anyone in your practice is able to view information on a single, you know, or in a single page view and get a quick reference of what's going on with any particular patient. You can manage entire patient populations, and there's certainly time saving. So if you're trying to find a certain piece of information, you know, you're no longer going to have to dig through a bunch of files or, you know, go searching for a specific patient record. One thing that's also a major benefit, especially of the customization of your templates and, you know, EHR is excuse me, chart completion. So when you're really intentional about the information that you're trying to get from your template and from your patient, you know, and when you've customized it yourself, you sort of have an idea. It's like a natural flow of things of what needs to be completed. And when you know, have that concept really like built in you, then you can complete all the data fields in a quicker amount of time. It's one of the cons is, you know, when somebody else does the customization of your templates, it can kind of feel like a scavenger hunt for information. You know, you may have a ton of pick lists and you're looking for, you know, the specific symptom or a specific physical finding. And if you're not the one who, you know, who wrote something, it's a lot harder to find that information. I have not seen yet an EHR that has a Control F feature, which is just, you know, find something specific. And, you know, another thing is if somebody else is customizing all of the details within your EHR, they may use different names for the same thing. So
even,
you know, that is.
So my feeling is that, you know, and I hear a lot about this, you know, through our network and the consultants, you know, practices will often hire a consultant to help them do customization and template building, that sort of thing, but they also want to have a first-person hand in how that is designed. Otherwise, they're going to end up, you know, with somebody else's vision of how that workflow should look. I mean, it sounds like that's what you're saying.
Yeah, and any consultant that comes in, I mean, should have an extensive interview with the doctor. I mean, the doctor may not be the one that's clicking the buttons, but that consultant should certainly have a strong relationship and know what that doctor's looking for, you know, in detail and specific, so that they can create their vision, so that it feels familiar and it feels, you know, natural for when that doctor goes in and is seeing certain patients.
And at this point, we're making the assumption that everybody on this webinar today is utilizing a health record, which is, there's a high probability of that. But there are also folks who are moving from paper to electronic and thinking about, you know, what the complexity of that task might involve. And so, you know, I just want to make sure that we also, you know, speak about the fact that when you're moving from paper to electronic, utilizing customization and templates is the way that you can help that electronic workflow feel a little bit more like your paper workflow. Now, it's not going to match ever identically, of course, but, you know, if that's very familiar to you, and the sort of out-of-the-box version is completely foreign, then customization is one way that you can kind of rejigger the electronic workflow to feel a little bit more like a paper process.
Yeah, that's exactly right. Some EHRs will actually let you copy paste into their templating, so that you can actually take your previous paper template, if you have it in a Word document or something, then you can just paste it right into the EHR and kind of build data fields around that. But typically, yeah, the template and the progress note should be about the length and size of your previous paper documentation. Mm-hmm. One of the cons actually is, you know, what I mentioned here is cookie cutter encounters, and some people call them clone encounters. But if you have, you know, all of the box checked or ticked for, you know, the history of the present illness, and it is so extensive that, you know, and you just click normal, or, within normal limits for each patient, then all of those, will look the same. And when they translate over, then you kind of have, it's like a copy paste of each progress note, which can be a bad thing, especially if you're sending a similar looking progress note to the insurance companies, or, it could eventually trigger an audit. So it's important to make sure that you're not putting in, I think of it as like the 80-20 rule, where the majority of your patient visits are going to come from, just a small portion of your patient population. So when you're building the templates, you want to make sure that you're not trying to make it so detailed that it's enough to include it for every single one of your patients. Just trying to focus on the majority of your, what are the majority of the problems that you see. Focus on those ones first and sort of make it general enough so that you can, switch some of the findings and details so it doesn't feel like it's the exact same note that you over and over and over again. And there's a little bit of finesse involved in that. So,
yeah, no, that.
Of course, there's also.
Go ahead. No, I was just going to say, I mean, that makes sense. And sometimes when you build templates, it can help speed up, your processing around that utilization of the medical record, kind of, improve the speed of the tasks. But by the same token, you're right. If you automate it too much, then you're going to end up with a loss of some of the quality of that patient reporting.
That's right. That's exactly right.
So the question that I asked earlier was, who does this part? You know what I mean? Who is going to do the customization piece? Who's going to do the template building? A lot of buyers of electronic health records believe that the vendor is going to do all that stuff for them. And I know, in my experience working with clients and in my consulting business, that's not necessarily true. Some packages of support include customization, some don't. Some product support folks will provide those kinds of services, some of them don't. Some of them provide the training to the clinicians, but then don't necessarily provide the post-implementation support around it and kind of leave them to their own devices. But in the cases where the vendor will provide it, why wouldn't they just do that instead?
Well, like you mentioned, all EHR vendors, they have different levels of support. So I would recommend, first of all, know what they offer, and know and take advantage of what they offer. If they do online training, make sure you take advantage of that. Watch it as many times as necessary. And if they offer, the support of customizing it for you, then great, do that too. But make sure you do it with them, because they're not going to be able to read your mind. They're not going to be able to know exactly what you want. What is your approach? What's your technique? And every doctor brings their own experience to their practice. And at the end of the day, there's nobody else that's going to be able to design a template that thinks the way that you do. So one thing to consider in addition to that is that, their job for the most part is to, teach you, implement the EHR, make sure that it works, teach you and your users how to use it, and essentially then they oftentimes will go on to the next. And I like to think of it somewhat similarly to like an Apple iPhone. Like we all have a smartphone, or many of us have smartphones, but how we use that, what software or applications that we download, and and what is up to us. It's a very personal thing. So they provide us for with the functionality, and then how we use it is all it's a personal thing. So the pre-built templates, a lot of them have, as we've mentioned, many pre-built templates. But they have a tendency, they can be cumbersome. Digging through them can feel a little bit like a scavenger hunt. It can be time consuming, it can be frustrating. And essentially, like, the EHR vendor can help you start customizing it. That's certainly a good idea, but this isn't, it's going to be an ongoing process. So it's not something that, like, even if they provide you with a week's worth of training, that at the end of that week you're going to be like, okay, I know everything, I've got it, it's done. We're not going to have to make any changes anymore. It's an ongoing process. So you're going to want involvement from people in all the departments and working together, and essentially at the end of the day, when you've got people from different departments working together to to customize your EHR, it's going to be better off for your practice, because you're all going to understand how things move in an electronic environment. So another point is that EHRs have limited resources. If you have an EHR that you paid everything up front, once you paid, then they might walk away. There are subscription-based EHR companies, and those ones in particular tend to have more of a vested interest in your success, because they want your check next month and the month after and the month after, so they typically have, you're paying for ongoing support, and that, that's something to consider.
Okay, so I think that's a good point, Joy. Like, in other words, the vendors largely are going to have a level of investment in helping the practice. In oftentimes relating to how engaged they are with that practice in an ongoing way. That's not to say that, large practices who have purchased their electronic health record well in advance, kind of flat rate, and started their process that way, doesn't have, the potential for resources. There are certainly other ways to get at having some help around that customization. But I think you're right, in terms of some of the subscription-based services, they do tend to be more available over time.
Well, there's always a fee. I mean, you can always pay for them. So that, if you want extra customization, if you paid up front, you can certainly contact them, and I'm sure that they would be happy to help you for, oftentimes for a fee. So just make sure that you keep that in mind.
And so on the template building and customization side, just with a little eye toward templating 101, what are your thoughts around how providers can begin to think about customizing that health record if they haven't done it so far?
Well, I would say first, rule number one, don't do it by yourself. If you can get a team together within your practice, I would, work with them. It's good to have other input, and also, lean on your EHR vendor if it's possible that they could review it. One thing that I've been thinking about a lot lately is, if you were to create your template and you're afraid that maybe you missed something and you're customizing certain areas, make sure that other people in your practice review it, and also, run it by the EHR vendor. If there's something that's glaringly missing, or they have that experience, and they should be able to point you in the right direction. And as far as like the nitty-gritty of customizing the EHR, a lot of EHRs do it differently. So, like, as I mentioned earlier, some of them work off pick lists. So you're creating check boxes for each symptom or each finding, and kind of detailing it out into like decision trees. So you have to really think those through if you're customizing. Others do, the copy and paste. Some you have to do across the board. So you can only maybe customize a template for all the doctors within a practice, or at least start off with everybody working off of the same template, and then doctors can go in and slightly make slight changes within each template. One thing that you're able to do in many is build favorites. So if you have a template that everybody is working from, and then you in particular are seeing the same type of problem come through it, through your patient visits over and over, you can choose those favorite pieces. So a lot of them divide it up through SOAP notes. So you'd be customizing literally the subjective, objective assessment and plan, piece by piece. And then I've seen others that break it up even further so that you can just tackle the history of present illness, or just tackle the review of systems, or just tackle, the physical exam. And so there's certainly, like, I would say do it slowly, like do if you can, and have the option of just like picking it up, chunk by chunk, and making sure that each one is complete. Then that kind of lends it to be a little bit more of a gradual process and not so overwhelming. So you can just sort of, feel comfortable and confident that you're going in the right direction over time. And one thing that's really important is to standardize your naming convention. So if you do end up having a lot of templates, you want to make sure that everyone in the office, because specifically for reporting reasons, is naming them the same thing. So, for example, you're not going to want to have, if you have something that has to do with kidneys and somebody has a template called CKD and someone else has a template called renal failure and another person has one called kidney failure, when you try to pull up a report on those things, they're not going to all be together. So that is certainly something to keep in mind. And also, I like to lean on the questionnaires, especially for specific specialties. Like, for example, allergists. Allergists need to ask each of their patients questions that are much more detailed than some other specialties. Like, they need to know, what kind of bedding does their patient have, what kind of heating is in their house, do they have any pets, that type of stuff. That's the kind of thing that they can, like, build a questionnaire and input that in to their template. So, it is a process. It's something that, number one, don't do it alone. 2, be patient.
And once, just out of curiosity, once you did, so you were mentioning, within a practice, people have, different naming conventions, and so therefore they go searching for something, and now you've got, 3 different, 3 different templates that might address a similar issue. Is that something that can be fixed after the fact, or are you kind of stuck with it once it's, you've drilled down and named things incorrectly?
I'm sure that it's something that could be fixed, but it's something that would take time, and it's one of those, like, if you can avoid that problem in the first place, it's certainly a lot easier to prevent it than it is to fix it after, because someone's going to have to go gather all that and dig through all that data and kind of compile it. So, yeah, I'm sure that, those types of things can be fixed, but one thing is you need to know what it is you're looking for. So, if that's something that the practice isn't even aware of as a problem, then you're not going to know it until way later. You may just get reports that are inaccurate.
No, makes sense. Okay, one of the interesting questions that came up as we were putting this particular presentation together was really how far into the workflow and how deep should that provider go when they're deciding, what direction to take around templating and customization?
Yeah, that's a good question, because you can go so far down the rabbit hole and try to think, oh, I have a patient that, has this condition or this specific disease, or, and you want it to have something that you can automate everything. But at the end of the day, you cannot automate everything. You need to be, just like set up the starting point, so that you can take it and run with it. So really you're looking for making sure that the critical clinical content is included in your template designs. And so when you're customizing, make sure you don't cut any of that stuff out. And, but you do want it to be intuitive. And I think that, when you look at your dictated records and when you were on paper, what did your progress and patient notes look like then? You really want to try to match that. If your note was only a half a page long before, then don't try to be creating 3 and 4 and 5 page progress notes here. As long as you've got the critical clinical content, you can keep it simple. you certainly do want to prevent, like we were talking about, the cloning or the cookie cutter templates with, especially with HPI and ROS. That is something that can happen. And if you don't, sometimes they can be so long, and if you don't really review everything that's in there, especially for follow-up visits, you'll bring over inaccurate information. So, I mean, specifically with those two areas, keep it simple. The best way that you can really just know where you stand and, if your templates are making sense is, print them out. Print them out and read them, and go over them with a red pen and read them line by line. What makes sense, what doesn't, and use that as a place to, all right, how do I fix that, and then go back. And and a pro tip, like how deep should you go? Pro tip is if you can input as much information before, I don't know where you are in your stage right now of EHR transition, but if you can put as much information about your active patients before you go live, or before you start using your templates, you will be at a greater advantage. So you want to just make sure that that everyone is able to spend as much time in there and get comfortable with the system, and as much time as you can afford for every user to be in the system before going live. Be willing to spend it. Some people say that it may take like 2 months, in the customization process before you go live, but I don't know that everyone has that luxury. So.
Right. Again, I said one of the biggest complaints that I hear from practices when we're talking about templating and customizing is the amount of time that it takes, and the overall kind of labor division within the practice, and who it should go to, and how many people need to be involved. I think that's one of the biggest discussions. In that, relating to that though, when they do template and custom work on the health record, I know that you're a meaningful use attestation expert. How does that process apply to accomplishing that meaningful use attestation?
Sure. Well, I keep going back to the phrase that this is what they actually meant when they called it meaningful use. Like when you really get into it and you're customizing and making that your EHR system work for you and your unique practice and your specialty, like that is very meaningful. So, and that's actually what they're trying to build towards, is making sure that everyone is meaningfully using it. And we've overused that term so much, but when you really think about what it means, I think a lot of it has to do with the customization and, really capturing the workflow, your current workflow. So it's about really truly knowing your system inside and out. And, one thing that I recommend for folks to do for really all EHRs is they should have a meaningful use dashboard or some sort of reporting mechanism. I've seen a lot of doctors that just don't go in there. They sort of just ignore it for a while. But you really should pay attention and figure out what's going on. How does that reporting capture the data that you're entering into the system on a daily basis? Like, you maybe think that you're doing everything correctly, but you've missed one button. Or one click, and then it's not then capturing that information into your meaningful use reporting. So, once you know what it is it's looking for, it's easier to be intentional and sort of aim to put that information in there. Another thing to consider is, the certain criteria that they are asking you to meet. So, some of the stage 1 criteria is, listing patients by their conditions, or sending patient-specific education materials, or reminding preventative and for follow-up care. And specifically with, understanding how your system manages that information is going to help you decide how you capture and give that information. For example, the patient-specific education, if you see a certain, the EHR systems talk about customizing. If you give handouts or, you give certain pamphlets to your patients, you can include those either like by, scanning or uploading them into your EHR and then emailing them to your patients, or at least tracking that you've given that patient some sort of counseling and that type of education that's specific to them and their problem. That is certainly an area of customizing that's really important for meaningful use. Another thing to think about is the clinical quality measures. So that is a requirement of meeting meaningful use. And, they have, I think in stage 1, 6 clinical quality measures that you have to meet based off of a list of, I think it's, 12 recommended. And so, knowing which ones you're shooting for, there are things like, are you tracking hypertension, or maybe you're tracking asthma, or maybe you're tracking, weight assessment, or childhood immunizations. But, knowing which ones you're targeting for is going to help you, know which areas to customize your EHR. So I like to think of it as, the whole customizing and templating and really getting to know your EHR. It's not just a return on your investment, it's a return on information, being able to do more with the information that you have.
Yeah, absolutely. We have a couple of questions in here. I wanted to see if we could address those before we wind up. One person asked that is asking that in their practice they've had their electronic health record up and running for a couple of years now, and nobody in the group ever learned how to do customized templates. So they've been working, clearly, I'm guessing based on that question, they've been working with it out of the box all along. The question for you is, is that something that 2 years later they can still find help? Or
Absolutely. Yeah, absolutely. It's never too late to do anything like that. No, there are people out there willing and happy to help. And, it's just a matter of, digging in, and it would really just be like, all right, that's getting to know you and your practice, what are your needs, and then learning your system and figuring out how it can meet your needs. So I certainly wouldn't be afraid of going down that, if you haven't started down the road of customization, don't think that it's not open to you. It's always open to you. You should, it's like I said, it's an ongoing thing. So if you are now comfortable using your EHR and your practice is, doing well with what you've got, at least now you probably have ideas of where you can improve. And, that's probably good feedback to whoever it is you get to help, or point you in the right direction of saying, hey, I'm looking to do X, Y, and Z. Then they at least have a direction to go in. So yeah, go. Don't worry about that. There's certainly more to do.
And another question is, what are the best areas of the medical record to create templates for?
What do you mean by that? Like by specialty, or areas of the actual record?
Workflow, so, maybe areas of the workflow is my guess.
So areas to pay attention to, you would be considered one with the template itself. So anytime you're with a patient in a patient encounter, that if you see certain problems you want to over and over and over go, you're going to want to address, maybe making it templating or customizing the history of present illness, anything that's involved in the SOAP note. That should be customizable. So even including, what codes you commonly use or bill for. And then, of course, there's also communications, questionnaires, the order sets, if you have, and, also think about how you're connected to different labs and, even prescriptions. Do you order the same prescriptions over and over again? A lot of areas you can really, create short lists of, common things that you use to be able to just reference, instead of seeing the entire database, you're just looking at the stuff that's relevant to you. So it's kind of a broad question, but.
Well, yeah, and so out of that, what's interesting, one of the, I realized kind of toward the beginning of this we didn't really talk about sort of what the definition of a template is, but in terms of creating templates, really it sounds like the goal is to make more efficient the things that you do most frequently. So if the question is, what are the best areas of the EMR to template, my guess is that's different from practice to practice, where, in some environments, the things that they do most frequently are going to differ from other environments. Would you say that's true?
Yeah, I absolutely agree with that. And I also think it varies EHR to EHR. So it's a combination of the two. Is what areas does your EHR allow you to customize and template, and to what extent? And then also, what are your practices needs, and what is your typical workflow? Or really trying to marry the two and get them as much overlap as possible.
So another question that came through is if I have the same EMR as a colleague of mine, I'm in my head I'm thinking that this relates to some of the clients that I've worked with over the years. The question is, can you share templates with other practitioners?
Most of the time, yes. So there are certain EHR systems that will allow you. I know of two off the top of my head that you can actually send them through their messaging, like their online, cloud-based EHR systems that you would log into, and you can from there share your templates if you've come up with something, and then others who are working through the same system can share with you. For server-based EHRs, one thing that I've seen is, a template after it's been customized is held in like a SQL database that maybe is compiled of 4 or 5 zip files that, you could talk to your EHR vendor that you can share. They can absolutely share those. They just need to go find those files in that database and move them over, to the other practice or the other doctor. And certainly within an EHR, so if you have doctors that are working on the same EHR that don't work in the same practice, they should certainly be compatible to be able to share, especially if they're working from the same system. That may require a conversation with the EHR vendor to facilitate that, but there are others that are more streamlined. So it's dependent on your EHR.
Well, that's great. Well, thank you, Joy, for joining us today for the Learning Lunch. I'd also like to thank all of our attendees. Again, all of the registered attendees will receive an email with links to both the recorded and PDF versions of this session. Be sure to join us at Format Approved for our next Learning Lunch, which will air May 14th and is on the topic of when to hire versus when to contract healthcare information technology staff. Keep your eye on your email box and on our homepage for upcoming topics. And thank you again, all of you, for joining us today. Thanks, Joy.
Yeah, thanks, Wendy. Thanks.